Placenta abruption, a term uncommonly mentioned yet a very serious complication of pregnancy. We often know that during the 9 months of pregnancy, the mother has to take good care of herself, and if there are no hiccups, any complications, if at all, will arise during delivery itself. However, many things can happen during these 9 months, one of which being the abruption of the placenta. The placenta develops in the uterus during pregnancy. It attaches to the wall of the uterus and supplies the baby with glucose and oxygen while transporting carbon dioxide and urea from the baby to the mother. Abruptio placentae occurs when the placenta separates from the inner wall of the uterus before delivery. This separation is caused by degeneration of the uterine arteries that supply blood to the placenta. These diseased vessels rupture, causing hemorrhage or heavy bleeding and separation of the placenta, which in turn can decrease or block the baby's supply of oxygen and nutrients. Placenta abruption can be classified as partial or complete, depending on the degree of separation from the uterine wall. It is diagnosed by exclusion, that is, a ruling out of other possible problems. In this case, using ultrasound, placenta previa, or the attachment of the placenta in the uterus in an abnormal position, is ruled out. Placenta abruption is the reason for about 15% of infant deaths around the time of birth. So in this setup, we have the egg representing the placenta, the sticks and straws representing the uterine vessels, the bowl, the uterus, and the water, the blood. So in placenta abruption, the uterine vessels will degenerate, causing hemorrhage, so blood will be lost. Common symptoms include sudden onset abdominal and back pain, as the uterus will tense up and become rigid, as the strong muscular layer contracts to clamp down on the uterine vessels to reduce the bleeding, uterine contractions that seem continuous and do not stop, an enlarged uterus disproportionate to the gestational age of the fetus, decreased amniotic fluid volume or oleohydramnios, fetal movement and heart rate, and disseminated intravascular coagulation or DIC, which is the formation of blood clots throughout the body, blocking the blood vessels, leading to chest pain and shortness of breath. This is because the decidua bacillis, or the layer of the mother's blood, is rich in thromboplastin, so an abruption would release it and cause widespread coagulation. Vaginal bleeding is the most common symptom, though it is possible for the blood to become trapped inside the uterus, so even with a severe placental abruption, there might not be any visible bleeding. In some cases, placental abruption develops slowly, chronic abruption, which can cause only light intermittent vaginal bleeding. The amount of vaginal bleeding can vary greatly and doesn't necessarily indicate how much of the placenta has separated from the uterus. The cause of placental abruption is often unknown. Possible causes include trauma or injury to the abdomen, from a car accident or fall, for example, or a rapid loss of amniotic fluid that surrounds and cushions the baby in the uterus. The placenta is less elastic than the uterus, so strong forces from traumatic events can cause the placenta to shear away from the elastic wall. Factors that can increase the risk of placental abruption include placenta abruption in a previous pregnancy that wasn't caused by abdominal trauma, chronic high blood pressure or hypertension, hypertension-related problems during pregnancy, including pre-eclampsia, which involves high blood pressure, fluid retention or edema, and protein in the urine or proteinuria of the mother. HELLP syndrome, or the breaking down of red blood cells in the blood, or fall or other type of blow to the abdomen, smoking, cocaine, and methamphetamine use, which causes significant vasoconstriction of the placental blood vessels and hence an abrupt increase in blood pressure, increasing the risk of an abruption, early or prolonged more than 24 hours rupture of membranes, which causes amniotic fluid leakage, infection inside of the uterus during pregnancy, chorioamniotis, old age like being older than 35, a short umbilical cord, and thrombophilia, or the imbalance of naturally occurring blood clotting proteins. Placental abruption can cause life-threatening problems for both the mother and the baby. For the mother, she may suffer shock due to blood loss, blood clotting problems, failure of her kidneys or other organs resulting from blood loss, severe case of shock affecting other organs such as the liver, kidney, and pituitary gland, bleeding through the uterine muscle and into the mother's abdominal cavity, a condition called covillary uterus, and death. For the baby, it may suffer from limited growth from not getting enough nutrients resulting in low birth weight, not getting enough oxygen and hence developing asphyxia, premature birth, or even stillbirth. Treatment depends on the amount of blood loss and the status of the fetus. If the fetus is less than 36 weeks old and neither mother nor fetus are in any distress, then they may simply be monitored in the hospital until a change in condition or fetal maturity, whichever comes first. However, immediate delivery of the fetus may be required if the fetus is mature or if the fetus or mother is in distress. blood volume replacement to maintain blood pressure and blood plasma replacement to maintain fibrinogen levels may be needed. Vaginal birth is usually prepared over cesarean section unless there is fetal distress, because C-section carries an increased risk of DIC. The mother and the baby should be monitored for 7 days for postpartum or post-delivery hemorrhage. Excessive bleeding from the uterus may necessitate hysterectomy or the removal of the uterus and other surrounding structures if necessary. The mother may require a blood transfusion to replenish the lost blood or medication to help her uterus contract. Placenta abruption cannot be prevented, but certain risk factors can be decreased. For example, the mother should not abuse substances. If the mother has high blood pressure or has had an incident of placenta abruption previously, she should work with a healthcare provider to monitor the condition and reduce the risk of it occurring again. In a vehicle, the mother should take care to wear a seatbelt to reduce the chance of physical trauma. The risk of placenta abruption can be reduced by maintaining a good diet, including taking folate, regular sleep patterns, and correction of pregnancy-induced hypertension. In conclusion, placental abruption may not be well heard of, but it is a serious issue nonetheless. We will not normally hear of it as it is not popularized in the arts, media, nor culture. We are lucky that we are born without complications and that we have our mothers to take care of us when we are young. Thank you, and I hope that this video has given you an insight into placental abruption.